doing today on this beautiful Saturday? I hope that you are enjoying your weekend. And so today I am going to speak about the disruption that COVID-19 has caused, not only in the community, right, in each person's community, but also in communities around the world. So one thing that we can see from what has happened in the world with this pandemic of COVID-19. Thank you. Someone says, looking good, Judith. Thank you. You are very kind. And so, the disruption, right, that has happened since we know about it, right? It was early, or it was late in 2019 that we find out about the COVID-19. I know that for me, I have been working on planning to do my business, right? I am a behavior consultant, and so I dedicate my time into learning about human nature and how we humans tend to behave in circumstances, in different situations. Our behavior tends to change when our routines, even though we may not think we have routines, right? What we have find out is that we do, and they have been disrupted by COVID-19. And so we have heard about pandemics. We have heard about different diseases that had overtaken people in the past, right? But one thing is to read about it. We can imagine ourselves in a situation, but another is to be in the situation, right? It's a different thing. And so the disruption that caused, right, is basically when you don't know about the situation, what the situation is going to cause. So I say that in regards to panic, we have handled the situation well, right? Because even though this was something that was known, it was information given to the public, and the word pandemic was used. What I have noticed and what I have seen is that everyone moved to do what they needed to do in order for us to feel or to do something about it, right? Not just to feel, because feeling comfortable with the situation as the situation changes is one thing, right? But doing something about it while you're going through the situation, there's where resilience comes, or we become resilient. We learn how to cope, and that's what I have seen in the different situations that have happened. And of course, disruption will always bring out that part of human nature that that most of us, right, we don't want to show it. But undoubtedly, all these things can come, including fear, right? Fear of the unknown, because we don't know what's going on, we don't know what is happening. Also, misunderstanding information, right? Or not understanding information, that is another. So, education. Are you the cure for coronavirus, Judith? Me? I think the cure of things, cure as we will want to find with the situation that we are in, with our imperfections. I don't think that we can find cures for everything. Maybe for some things, yes, there have been cures for some things. But no, I do not know. We have already found the cure. It's called Judith. That is hilarious. That is hilarious. He must be joking, right? Right? It is funny. It is very, very hilarious. Entertaining. Right? So, I am an educator also. So, behavior consultant, consulting behavior. And I also have added, and I have, like I said, I've been planning on doing my business while I've been recuperating also. And most likely you can see from my videos in the past, my demeanor is different, because it depends. Demeanor depends on how we feel, and sometimes we put a smile on even though we feel like we don't want to be out there doing anything. And at times I had felt like that, and it has been because of many different things, which is something that I also do. I was planning for in March. All of this was going to happen in March of this year, right? But then the pandemic came, and guess what I did? I went in, and I do not want to get sick, right? I cannot afford it. Unrelated to the topic you are talking about, but Judith, you are gorgeous. Okay, thank you. And I said, you are very kind. Very kind. You're very kind with me. So, some of the things that I educate on are, which is something that I'm doing now new, that is for business, education for your employees, is ethics in business, principles of ethics, guidance through ethics, and the application of it in the company. And of course, this is very important because we all come from different backgrounds, have different teachings, have different levels of education. And ethics is something that it can be personal to a person, but when it comes to a business, we know that in a business, ethics relates to the business and how the comportment of everyone, of course, make that business succeed. And when it comes to customer service is one of the key features of a business. Is what will make you keep that customer, or what will make that customer run to someone else that can provide customer service. Studies have been made in regards to customer service that those who provide best customer service to their customers, even though the price might be a little bit higher, those customers, clients, prefer to pay for better service related to customer service, related to how they were treated. And of course, it makes sense because we all want to be treated nice, especially if we're paying for products, right? Or services. That should be the case. So customer service principles and application is one of the courses that I have for education besides ethics. And then there's also language in Aprenda Inglés for those who want to learn English, and this is for those who are in the business. But then it is also for personal education, and that is for the business area. For personal education, I have the course, and this is one of them, and it's related to behavior, right? And related to skills learning. And so the course is for adults or children, and it is social communication skills. Social referring to society and how we relate to one another in not only necessarily social events, but in society in general, with whomever we use our skills of speech, right? So then, of course, I am doing autism awareness and education. I do that as volunteering with others who are doing this, but of course I am doing this on my own, independently, not through a company, but just as myself. And so I dedicate time for autism awareness and how autism affects our communities around the world. And so this course, Adult and Children Social Communication Skills, it's also related for those in the autism spectrum disorder and also those with attention deficit disorders. And so these are individual classes and sessions. And I have a class also with physical activity, and of course that is guiding also with the nutrition that goes along with the physical activity, and so you can feel better. And then I also have another course or class in regards to beauty and style guidance, and learn how to gain and maintain your self-esteem, right? So it's and then I also have the language learning for adults and children in Aprenda Inglés Fácil. So that is what I offer. That's what my services are. And of course, I haven't been mentioning you know a lot about beauty and guidance students. Well, yeah, I have gone to cosmetology. I have cosmetology training. I have a different training in different areas. And so when you have different trainings in different areas, for example, cosmetology has to do with health and science. And so, you know, you have a broader view from, you can view different matters from different perspectives, from different views, and have a different understanding. Maybe that person who only has maybe one set of study in an area. And so I also in the past have done medical coding and billing in and this has been in primary care, for primary care physicians, and also for internal medicine and geriatrics. So I have understanding of how the body functions. I have understanding of different things that have to do with the whole process of the patient. And of course, coders are not just there with a book, no, with a book looking at numbers and just putting, well, the doctor did this, and so we're just gonna put this number here and code this visit and just send it to the insurance for it to be paid. No, there is a lot that goes into billing for one patient. There's a lot of things, details that have to happen when it comes to the healthcare, the administration part, the billing part, the part where the doctor gets reimbursed for the services that they provide through their medical knowledge. And of course, also that includes not only the doctors, the specialists, in any type of specialty, but also the nurses and everyone who have to do with the patient and the patient visit. So we coders have to have the same understanding that doctors have and the same learnings that doctors have in order for us to understand the patient chart, what the doctor did, and how to code it according to Medicare guidelines, and also according to Medicaid guidelines, and also according to private insurance, automobile insurance, workers' compensation insurance, and third-party insurance. So besides that, you have to also know, of course, the process of disease and how to code the record in order to be reimbursed correctly for the services that were provided. So I know all that information, and I combine it along with my cosmetology information. And of course, I also have done business accounting, and so I also know in regards to finances, and not just count 1, 2, 3, 4, but also know how this impacts, right, our wallets and everything. So that is what I do, right? I had not been talking about these topics because I really wasn't ready for me to do what I wanted to do, and I like to be ready for things. So today I wanted to continue to speak. I just wanted to introduce myself, right, to you, and so I wanted to continue to speak in regards to the disruption that we have had with the COVID-19, but also the opportunity of resilience that we have, right? We know that other countries, and it tells, because I like to concentrate on how human behavior is and how we by nature will respond to different circumstances, and it will depend on how we are. But then we might see the situation maybe only when it comes to us, right? So like, we're like concentrating in us, but then if you put a community, right? A community, a city, a state, a country, and different countries. And you see, thanks to technology, we're able to do this, because I believe that we have been able to behave and react and take action, and not go into the way of panic in regards to COVID-19, right? Because there have been disruptions, but it haven't been because of COVID-19. But so today I'm just speaking about COVID-19, the disruption, but then how also we have shown resilience, because we have to see that we have done that so far. I have seen that, even though, yes, because we humans tend to focus, to concentrate on the negative, and sometimes we like to stay stuck in it and repeat that same mentality. So then, right, so we have the same mentality, and so but if we realize, well, let's see what good things we have done so far, right? Because sometimes we can get, as I said, stuck in the negative, and then whatever people do, it doesn't seem enough. Something gets done, then we're still not satisfied. We still want more, and sometimes more is needed. Of course, we have to be reasonable, right? Does the need exist? If the need exists, then yes, it is, of course, action need to be taken, right? But then we also have to recognize for what am I doing personally, right? Because if each and every one of us will ask that question, and the reason why I say this is because I have seen in the news, and I'm sure you have also seen in the news, that New Zealand, right? New Zealand, in regards to the coronavirus, the country has been able to deal with the situation, right? And I want to bring the matter, right? Because also just a few days ago, right? And we have to what I want to bring the attention to is that we need to focus on the illness of COVID-19, or what it can cause. Because few days ago it was said that there was no more COVID-19 in New Zealand, right? But today is August 15. So on August 13, CNN reported that New Zealand was acclaimed a world leader in handling COVID-19. Now it's dealing with a fresh outbreak. And I think we have seen this in other countries, right? So we may be thinking, well, you know what? There was hope, right? Well, at least I felt like that, right? There's hope. New Zealand is no more COVID-19, right? And but as I also have mentioned in the past, is that this situation with COVID-19 is a one-on-one learning situation, because it seems that it do one thing, and then it does another, and then it does another, and then the way that we react to it will make the situation either better for us or worse for us. So yes, our attitude counts in regards to realizing that we need to take measures to protect ourselves, that we are not protecting ourselves from other humans, right? But that we're protecting ourselves from becoming sick, and from, if we are infected and asymptomatic, then that we protect ourselves and we protect other humans. That will be the nice and kind thing to do, right? That we become kind and become also aware that we can do much by protecting ourselves, that this virus is a virus that is not as any other virus, or for example as the flu, that most of us can survive the flu. I know that last year for me, I almost ended up in ICU because of the different conditions that I have. So my lungs wouldn't take COVID-19 because of the conditions of my lungs. So we have to take that into consideration. So of course, everything has been disrupted, right? Healthcare, finances, relationships, business relationships, personal relationships, the environment. And so when it comes to finances, we know everything has been in one way or another, either positively or negatively, have been disrupted in some way, right? Employers, employees, the way that we do business, all of it has been a challenge for everyone. And of course, in at this time, it has given more for us as humans to do things differently, to think differently. And so there is where our resilience comes. And of course, we have done a lot. But we can do a lot more, right? We can do a lot more when it comes, for example, meeting the needs of the communities, and assessing the situation in regards to not personal gains or personal views or proving points, but more as realizing the situation of COVID-19, how it affected other countries, how other countries are being affected, and how they are dealing with the situation, because we can learn from one another. And as I said, thanks to technology, we can do this now. We can share information, share opinions right over the internet. I have seen it all along. I have even been saying my few little words here and there. And so we all, as a community worldwide, can become resilient in this pandemic situation that we are all in. And of course, it is called pandemic for that reason. And then taking into consideration the guidance we are receiving from those who are experience in this area, right? We have to, there's nothing wrong with listening to what they have to say, or with whomever have to say, right? It is up to each individual, of course, to follow recommendations, and also if there are guidance and standards that are being established, that we follow them. For example, there have been the guidance from governments and from the medical sector that we have to wear personal protective equipment, the mask. So yes, there are many things that come with it, right? But it is a protection for myself and for others. And so, as we have seen, New Zealand has enjoyed a period of time where they have seen no COVID-19, but then now they are going back again with the situation. And so we have to keep that in mind, right? And we have to keep that in mind, including how children are being affected, and how children are faring with the illness, but then also if they can transmit this to their parents, their grandparents, and so taking that into consideration, taking all these things into consideration that we are learning, of course. And in regards to the latest, what I saw in for CDC, the latest media statement that they released was on Friday, August 14th, so yesterday, right? And so they gave this, and I'm sure there's other updates, but this is the one that called my attention. And so, updated isolation guidance does not imply immunity to COVID-19. And of course, I am sure that they are getting reports from doctors from different countries, right, that are right there dealing with this situation. I know I have friends in the healthcare, taking care of patients, and they are seeing these situations also, the same things that are being reported. And of course, we have to remember that those reporting information are humans, and they are providing information, but they are also explaining it from their point of view. So some information may come up in one way, and then someone else might present it in another way because of that. So, but it says that on August 3rd, 2020, CDC updated its isolation guidance based on the latest science about COVID-19, showing that people can continue to test positive for up to 3 months after diagnosis and not be infectious to others, right? So that is what they have found out. And so, contrary to media reporting today, this science does not imply a person is immune to reinfection with SARS-CoV-2, the virus that causes COVID-19, in the 3 months following infection. The latest data simply suggests that retesting someone in the 3 months following initial infection is not necessary unless that person is exhibiting the symptoms of COVID-19, and the symptoms cannot be associated with another illness, right? So that's what it says in regards to that. And then continues, and it says people with COVID-19 should be isolated for at least 10 days after symptom onset and until 24 hours after their fever subsides without the use of fever reducing medications. There have been more than 15 international and US based studies recently published looking at length of infection, duration of viral shed, asymptomatic spread, and risk of spread among various patient groups. Researchers have found that the amount of live virus in the nose and throat drops significantly soon after COVID-19 symptoms develop. Additionally, the duration of infectiousness in most people with COVID-19 is no longer than 10 days after symptoms begin and no longer than 20 days in people with severe illness or those who are severely immunocompromised. CDC will continue to closely monitor the evolving science for information that will warrant reconsideration of these recommendations. And then they have the New Zealand, we have the New Zealand news in regards to their new cases, right? Or he said, to quote, fresh outbreak, right? So those, the ones who are reporting, the ones who are being infected, the ones who are going through the situation themselves, we are seeing different countries how they're dealing with it, what is working, what is not, and so we have to take into consideration all of that. Yes, there are recommendations that are given from doctors, right? But it is ultimately, we have to see what is best for each and every one of us. And so, for my part, in my own situation, for my own health, right, my benefiting from PPE, wearing the mask to protect myself, protect my nose, protect my mouth as I speak to others, but also as others speak to me. But then if both people, both persons protect themselves, then there is way less chances of that person infecting me and me infecting that person. That is the way that I look at the situation, right? And so, of course, I protect myself, and I make sure that I follow the usual habits, right? Washing my hands, making sure that if I go out, then I come in, I make sure I wash those clothes, the clothing that I had, because I do not know, it might be contaminated. Maybe where I sit, someone spit in there or something, I don't know. So making sure that I'm taking those precautions for my own health, right? And it is not to make a panic situation of the situation, because I think that for some people the situation of COVID-19 is really something that they don't believe it for whatever reason, and even those who have been skeptical about it, they have become sick themselves and have come up and said, well, you know, this is really a serious situation after being sick from it. But unfortunately, some have died from it also. And so for some, it has taken that the more people that they see, I guess, dying from this situation, then they believe more, right? But finding considering all matters, taking everything into consideration, we will have a better understanding of how viruses, because COVID-19 is not the only virus that exists. There are other viruses that exist, and that can also be deadly for some people, right? And besides that, we have the bacterias, fungus, right? That also we can be infected with. So we just have to keep healthy habits, right? And so that's what I had for today, and I enjoy talking about this topic. And my name is Judith Mendoza. I am a behavior consultant and an educator. I hope you continue to enjoy your Saturday. Have a good day.